Assalamu alaikum and good afternoon, everyone. It's a great pleasure for me to be here, and I would like to congratulate the MS Saab of Chandka Hospital, Larkana, Principal Saab, and the entire pediatric team, and all residents and everybody for this great initiative of starting this new department of Peds Medicine, which is much needed, I think. Pediatric services, we all know, are a great workload of pediatric patients. Along with the gynae, I would always say mother and child together, they should be the priority for any tertiary care hospital. Because I am myself a gynecologist. I have worked all my life in Civil Hospital, Karachi, and I know the amount of burden that obstetrics and pediatrics face, and the lack of facilities, even in Civil Hospital, Karachi. It's not just in Chandka Medical College, the lack of faculty. It is the same situation across the board in all the hospitals, because I know about Civil Hospital, Karachi. We have been complaining all along for neonatal ICU, for the emergency, or the emergency is well developed now, but there are other problems. Because of that, we had to refer our neonates to NICH all the time, and babies were expiring on the way because of lack of ventilators, lack of staff and manpower, and all the same issues are there also. So I agree with all of you for the problems. There are a lot of problems, but I have joined only very recently. I am still getting to know the faculty, getting to know the administration and the staff. And like our Dean of Medicine said, that we have a board also. So I would like to have that meeting of the board of Civil Hospital in order to see what issues we can solve on that forum. And then the issues of faculty, we will be doing that in future, because currently not in a position to do it very urgently because of the budget issues. Let me look into those issues. Let me try to understand the setup and the problems in the administration, in the college, in the university as a whole. We have to try and work together. So the main thing is, I'm really happy to see that so many people are here, but I see imbalance of gender, which I always notice, because saying that we have so many females in medical colleges, 60%, 70%, I see only 3 or 4 ladies sitting here. But they're all sitting at the back somehow. So like we say, it's a male-dominated society in Pakistan. So that is very much visible over here also. So we need to have a gender balance, because girls are occupying majority of the seats in medical colleges. They are competing on merit, and then somehow they are disappearing. Oh, yes. So the seats are getting wasted, and the expertise that we need and the amount of women force that we need at the level of senior faculty, at the level of administration, that is also missing. So we need everybody to work. It's not that you get a seat and then you get married to somebody who makes you sit at home and look after the kitchen and forget about your residency and forget about everything. That is not on. One should not give in to that demand. Being a girl, you have to be very strong. Because unfortunately, health is a big issue all over Pakistan. Health and education are two major issues. And particularly mother and child is a big issue. Our maternal mortality and our neonatal mortality, one of the highest in the world. And if we see what are the causes of these mortalities, the tragedies, these are all mostly preventable causes. The causes that pregnant mothers are dying of, the causes that newborns are dying on the first day and dying later on in early childhood and infancy, these are all preventable causes but unfortunately we have not been able to devise any mechanism of healthcare system that we try to save. And if you look at these, if you want to see any developed country, look at their maternal mortality and their newborn mortality. It will be almost zero. No mothers, any civilized society will not allow their mothers, pregnant mothers, to die and their newborns to die on the first day of life. It's not acceptable. That should be health is the first priority. Education and health are the priority. And that is what we all healthcare providers have to enforce upon the government to listen to see the problems and the issues. Because this hospital is performing so much work. I can see for myself from the presentation how enormous the workload is and what it's a great performance, and I must appreciate all of you for doing this. Sitting in Larkana with limited resources, with limited funding, with limited expertise, you people are doing a great job. Particularly, I'm happy to hear that your researchers got the first position and second position. So that is amazing. This is what I would like to see and encourage the young people to come on to the research stage, because research brings money. Research brings the amount of money that nobody can give us in the whole world. Even the government cannot give you the type of money in dollars and pounds that the research will bring. But unfortunately, again, research is a weak area. We are not very focused, especially at undergrad level. Our students are not capable of conducting, performing, and publications. So I would like the faculty to help us on that aspect, how to train the faculty in bringing grants from abroad, from the big international donors who are ready to put millions of dollars into research. And we have so much data. Unfortunately, we are not utilizing that data. It's a precious data. It's a treasure of data that we have. Particularly in this hospital, you have so many patients, doing so many surgeries. How much are we publishing? How much are we doing research on the public health, on HIV? We have HIV center. I'm so happy to know that we have an HIV center. The whole international donor body will give you millions of dollars if you produce a research on HIV. Produce a research project or proposal on hepatitis, on malaria, on tuberculosis. These are the #1 agenda of international donors for giving grants for research to anybody who can bring the data. And we are the richest source of data, but unfortunately, I think we need that resource to make our team competent enough to write those grants and proposals and get the funding. It's WHO, it's Bill and Melinda Gates Foundation, it's World Bank, it's USAID, everybody will put in the dollars. And that is going to help us develop into a world-class university and institutes and medical colleges. Because that kind of funding, government is also very fed up of giving us grants. And when I met Secretary Saab, as soon as I took over, I met him and said that we are short of funds. And he said, why are you not generating your own funds? And unfortunately, I mean, it was very embarrassing for me. He said, all the medical universities are generating their own funds from their own resources, and this is the only university which is not self-sufficient in the budget reforms, and they are not producing any self-generated funds. We are totally dependent on the government grant. Whether it is Sindh government grant, whether it's federal government grant in the form of HEC, we are always begging for funds, but we are not generating our own funds, which we should be doing. By now, we should be a mature university. I think university was formed in 2008. 15-year-old, almost 15-year-old. We should try to stand on our own feet. We have to grow up as a university, as a faculty, as researchers, as producing our own, basically, funds. We have to self-generate our own funds and show the government that, see, we can do it, and that is why we need support from you also, because we also generate, and then they will be happy to give us more. First, we have to show them our performance. that our students are doing research, our faculty is publishing in international journals, they are bringing so much revenue, they are getting the grants. So we want to develop now into a world-class hospital and world-class university and medical colleges, and we want to develop it more. We have the Arija campus. It's all lying 200 acres, is lying barren. We can make a world of medical city over there. All the institutes like Gambat Bhatti Sahab is performing such a good job. I was really amazed to see the bone marrow transplant that he's doing, the liver transplant, the kidney transplant, the cancer hospital, the rapid response emergency system. Why are we not doing it as a university? It is our job to provide these services to our patients, because then our residents will get opportunity to work over there, and we can ask for the grant from the government that we need resource to operate these systems, to operate the MRI systems, to CyberKnife, the Gamma Knife, and we develop these institutes. First we have to do something and show the government that we are capable of doing it, and then they will give us the funds blindly. But right now, unfortunately, it's a very bad situation that government is not happy with the performance. Somehow we are not producing research, we are not producing result-oriented university or any impact. We are not showing any impact in services also. We have to try and work together and try to improve the setup and collaborate with each other, and I think this is a strong team. This is an amazing team, especially our students are amazing. They are competing everywhere. In Karachi, I can tell you, my residents, the people who come from Dow, usually they all go abroad. So the whole civil hospital is being run by residents of Larkana and from Nawab Shah, and they are doing amazing work. They're so hardworking that it's unbelievable. They just need an opportunity. They just need some guidance, and they will do it for you. So I think we will try to solve all the issues. There are multiple issues of space, of OPD, and I know these are all genuine issues. I can see it for myself from the presentation that these are all genuine issues. There's lack of faculty, lack of space, lack of resources, but it will take us some time to develop as a standard sort of institute or a standard sort of university. So congratulations once again for doing this amazing job, and I would like to request for a meeting of board as soon as possible so that we can discuss the issues of the hospital. And I wish you all success with this unit, and then we'll inshallah improve it further, the services and for the patients. Thank you.